Hello and welcome everybody. My name is Dr. Chris Kammer. I am a board member with the American Academy for Oral Systemic Health. Very excited to be here today because we've got a fantastic announcement that I know you're all going to be interested in. And I have a guest with me today. This is Linda Miles. She is probably a name so synonymous with dental CE over the years, one of the top consultants and speakers in the entire dental profession. And we've got some what we would consider breaking news, exciting news that we think is going to really be help with a very powerful message that needs to be sent through the profession of dentistry. So, Linda, I welcome you.
Thank you so much. I'm happy to be here.
So now let's just get right into it, Linda. You have been, like I said, your name is synonymous with dental CE and speaking. Everybody in dentistry knows your name, and you have done amazing things throughout your career, but now you're shifting, you're focusing to something, or at least alongside of what you continue to do. You've got a new emphasis, and it is on oral cancer. And the American Academy for Oral Systemic Health has been in existence for a few years, and we are partnering up with you and a new organization that you're starting. So tell me a little bit about how you got involved in the oral cancer message.
Thank you so much, Chris. About 7 years ago, one of my best friend's sons had stage 4 cancer of the tonsil at age 42. And I really wanted to do something. I just felt a calling and a passion for doing something in honor of David because he was so young and such a good friend of our family. But I was too busy, and thank goodness in 2007, Dr. Rhonda Savage bought my company, and then in 2010, Lois Banta bought the Speaking Consulting Network, and that freed up my time. And at a dental meeting, I met Robin Morrison, who owns RLM Marketing, and with hers and my 80-plus years in dentistry, her brother had recently died with oral cancer, and my sister-in-law was dying at the time with oral cancer, and both Mike and Charlotte could have had their lives saved with early diagnosis. So we just share a passion and a calling, shall you call it, that this is the next step in my life, and now I have the time to work with that.
Okay, that's great news. I know that you have started an organization, a separate organization with a focus on the oral cancer message and what needs to be happening in the dental world in regards to screening for oral cancer and such. Tell me about the organization called IDOL. That's IDOL. Tell me about IDOL. How did that start and what is its mission?
IDOL was actually originally, the first year that we had it was in 14, I'm sorry, and we were calling it Dental Oncology Leadership Summit. And a hygienist called me and said, Linda, I looked up DOLS, D-O-L-S, and did you know that that stands for Dirty Old Ladies in Software? I don't think you want that name. So we immediately started assembling a new website, and we are now IDOL, and that stands for International Dental Oncology Leaders. And at our first summit in last year, we had 22 people from around the country who were from different various oral cancer, head and neck cancer, dental oncology, dental oral research people, and we came together in Houston. And Connie Sonnier, who was the Texas AGD executive director, was actually talking to me, and she said, you know, Linda, we need to put Jack T. Clark, which is the Texas AGD's foundation for oral cancer, we need to put those two together. And I said, well, if we're going to put our two together, how about, I'm all for encouraging participation and collaboration with those that are like-minded people, so let's invite a lot of people. And 22 people, professionals who speak on oral cancer. There's a group called Alana Smiles. They provide free dentistry for all cancer patients. There's another group called OCC, which is our foundation, which provides financial assistance to the patients who are going through medical treatment. And there were 22 different ones, and we decided that we would form an umbrella, so to speak, that all foundations could join.
What's That's amazing and that's exciting, because what's so wonderful about that is that that AAOSH, the American Academy for Oral Systemic Health, has always known about the oral cancer component, and we've been bringing that into our meetings, but we've always felt like it's such a big area that we've never been able to do it justice, because we're covering, sleep disorders, we're covering periodontal disease, we're even getting into heart disease and stroke and all the everything that's connected, from mouth health to body health. And oral cancer component we've been addressing, but it's like what's exciting for AAOSH and what I think is exciting for the world of dentistry is the coming together of these two organizations, because your focus and your attention is fully on oral cancer. And by teaming up with AAOSH, this is a very, very exciting news to bring to the world, because that's where we feel we can lean on you to bring to AAOSH the good message about what we need to be doing with oral cancer.
Well, it's really a collaborative effort, and we're just very, very excited about the interest that we've had. And one of the biggest challenges, as you know, is getting the word out about early diagnosis, because it's the only way to save lives. Every 24 hours, someone dies from this dreadful disease, and the treatment is oftentimes worse than the disease diagnosis. So early intervention and getting practices on board, that's everybody's mission.
What is IDLE doing, or what are their ideas about getting practices on board with this? I mean, oral cancer is just sort of, it almost seems like it's the slightly taboo subject to talk about in dentistry, because it's not cosmetic dentistry. It's not something that's always very tangible for the dentist. It's sort of like, oh, hey, I don't want to talk about such a negative thing, but yet it is a life and death matter that needs to be addressed, and it's important. It's why we're all oral health physicians. We need to be addressing it. Tell me, how can we get this across better?
Well, one of the things that we're doing is coming up with messages that the dental assistant can have and start a conversation with the patient when they're alone with the patient, waiting for the doctor. Hygienists are really picking up. They are probably our leaders in patient education. And you're right, Chris, so many of dentists don't want to mention the C word because they don't want to be an alarmist, but with HPV, I mean, the 20 to 40-year-olds are so at risk, and it is amazing to me how many parents and grandparents have no idea about some social activities for their grandchildren or children can be deadly. And so the question comes up, well, who's going to educate these young people about these dangers? Where are they going to learn about it? One group says, well, I think the dentist and the hygienist should tell them. Another person says, no, as a parent, I think I should talk to my children. The next person says they should teach this in health and education in the schools. And then the next person says physicians and nurse practitioners. And so I believe it's all of the above, but I also believe
Amen.
that young people who have had this dreadful disease and were unaware of the fact that they too can be, in the high-risk part of this problem, I think that they will listen to one another. So really and truly getting the message to the dental practitioners that you are the physician of the mouth, and it's standard of care to do a complete and advanced oral cancer screening, which takes only a couple of minutes. And the hygienists are picking up the charge, the dentists are picking up the charge, but we have so much work to do.
Now, back in the day when we used to do an oral cancer screening, it used to be just sort of take a look and see if something looked a little bit abnormal. And then I think a lot of dentists got to the point where it's like, well, there's all kinds of abnormal looking things in there. Is all of that potentially oral cancer? And then things started to evolve, and then there was the brush biopsy, and so a good number of dentists got involved with that, and then new screening technologies came out.
Right.
How are you approaching the whole screening aspect of it, or are you about getting the message out, or do you take it a little further and even advocate certain screening modalities?
Well, Eva Grizel, who is a speaker and friend of ours, and Jonathan Bregman, who is a dentist and speaks regularly on this. There's Dennis Abbott, who his practice in Dallas is completely 100% dental oncology, which means he takes care of cancer patients going through the dental clearances so that they can start their medical treatment. And when my sister-in-law was diagnosed, believe it or not, in her hometown of Lynchburg, Virginia, she couldn't see a dentist for 6 weeks because she had to go to Roanoke for someone who could take care of her needs. And we want all dentists to know that dental oncology, taking care of all cancer patients, is something that is going to be a major part of dental health care, and it's starting to catch on, but we have, as I said, so much more work and so much more education of the public as well as the profession of dentistry.
So your organization, IDLE, not only involved in education at the front end, getting the word out about screening and educating our patients and such, also about the screening and also about the aftercare as well. I mean, the care during the cancer stages. We're trying to take, I guess you're trying to take the stigma of cancer off the table, and let's get in there and help this. Let's make people aware. Let's do the screening and let's find it early. And if it's there or someone's dealing with oral cancer, can we still be in the game, helping and doing all the good things we should as in the profession of dentistry?
Absolutely, and it's just such an exciting thing. And to give you an example, I have a friend from high school, Retta Hill, and she and her husband are retired. They live in Florida 6 months, and they're RVers for 6 months. Retta has a daughter-in-law and a cousin with oral cancer. They're both survivors, thank goodness. And she puts a table together at these RV rallies, and she is an ambassador for oral cancer. And it goes to show you what one person can do, because a year ago, Retta told me that 90% of the seniors that she talked to at these rallies, major rallies, came up and talked to her and had no idea you can have cancer in your mouth, of your throat, of your tongue. I mean, they were just like they were unaware. This year, 90% of them came back to the table, and several of them said, we now have relatives who have recently been diagnosed, and they have all become little ambassadors. So one person can make a huge difference. And getting dental practices to do community events, because April is Oral Cancer Awareness Month, and we're getting so many requests for our purple bracelets. Robin has put together all sorts of marketing materials that dentists, OCC practices can actually give to their patients. Every patient walks out with a sticker that says, got mine. Well, when they go back to work or go back in the community, they say, what'd you get, your flu shot? Oh no, I had a complete oral cancer screening. Does your dentist do them? If not, you need to see my dentist. So it's actually becoming a marketing tool to become the go-to dental practice in your community that offers free screenings. And you know, so many practices are not really promoting this, and we're just on a real mission to change that.
Absolutely, and certainly as a public service, free oral cancer screenings are great. I'm thinking, like, how can we get, you know, dentists involved in this? They're always looking for ways to reach out to the public, to show the public some of the important things about the profession that we're in. Mm-hmm. Oral cancer screenings, definitely, and to do them for free, a great way to get people in touch with that. How do we reach the patients at large? Probably with that, but even though they hear about free oral cancer screenings, the average patient doesn't really think about that, oh, that's probably not for me, that's for people that probably smoke or drink. No. But we now know that oral cancer could potentially be a sexually transmitted disease via the HPV virus. That's a whole new world of oral cancer that has just opened up, I would say, recently or in recent times, and that's a brand new message.
It is a brand new message, and it's such an important message. And I think there's several reasons, Chris, that dentists shy away. We've already talked about one, and that is they don't want to be an alarmist and say you have a spot in your mouth that was there 6 months ago. Maybe you should have it biopsied. They just don't want to be the bearer of bad news in case it isn't something bad. And then there's another factor in the fact that insurance companies don't pay for oral cancer screenings. And so that makes it different in some practices. It's the money factor. Patients will say, oh, I don't have any problems. I don't need that. And I believe that if I were a dentist, I would say, you know, Mrs. Jones, a lot of practices have a fee involved for oral cancer screenings, but because our practice is so concerned about this debilitating disease and the rate of lives that can be saved by early diagnosis, we offer this complimentary to every patient in our practice. So look at it as a marketing tool. And then one last reason that they don't do it, besides the fee, the fear, the insurance, a dentist's wife shared with me that her husband was very keen on sending things for biopsies. And at one of the dental meetings, he was actually chastised by the oral surgeon who embarrassed him by calling him Dr. Overtreat or overzealous or whatever. And I had not even thought about that reason, but it could happen.
Yeah. And dentists are kind of a breed of sometimes very gun shy. You know, they're kind of concerned about the opinion of the specialist and of getting an image like that. But it's like, you know, I wouldn't mind faulting on the side of, and I don't even want to call it faulting because it's not faulting. We as a whole, there's so much more we need to do in terms of oral cancer screening. So let's really go for it and boldly go for it and not really care about the opinion, because all you have to do is just screen for one precancerous lesion and you'll feel like a hero, and your patients will feel like you've potentially saved their life.
And you will have saved their life, and they will tell dozens and dozens of people, because 90% of the patients that I've talked to that have gone through such debilitating treatments and lost a third of their tongue or more, lost part of their jaw, or had multiple surgeries, they said, you know, that like one nurse that I know had an earache, an unusual earache, and she went to ear, nose, and throat doctors. They couldn't find anything wrong. And a year later, someone finally took a panoramic x-ray, and she had a tumor in her mandible the size of a walnut. And this poor young lady is the mother of 3 young, beautiful girls, and she's alive today, thank goodness. But this is an example of early diagnosing. Just don't be afraid of overtreating or overdiagnosing.
You know, it's sort of like, and you're no stranger to this, being, you know, one of the premier consultants in practice management and speaking on the subject. But you almost want to treat every patient like that's your most loved family member there. And so with that in mind, you don't want to leave any stone uncovered. You want to, I mean, you really want to go for it and give them the best care possible and the most proactive approach to preventing them from getting cancer. So would you say that a message to reach the average person out there is that a screening is basically, it's painless, it's how do we reach the average public to even get them in to even request? You know, there's like 2 parts to this. You want to get the public to start demanding an oral cancer screening, but then you want to get the dental community to be offering an effective oral cancer screening. And it's not enough to just take a look there and, oh, I think everything looks okay, or here's, I mean, I've been in the camp. I think one of the things I like about myself as being in the dental world, and I've made every mistake possible in dentistry, and I have been one of those ones that said, oh, there's a little spot, so we're going to write that down and we're going to look at that next time, and if that's still there, but you know what? You forget about it, or somehow didn't make the chart, or you forget to look at it back in the chart. I'm just saying that
it can happen.
It can happen. And so so we want to get a message to the people, and we want, of course, the dental community to step it up. What message do you find reaches the average person out there to care about it?
Right. There on our website, oralcancercause.org, is Dr. Jeff Blackburn, who is in Midlothian, Virginia, a suburb of Richmond. And Jeff woke up one morning, he's a practicing dentist, and he saw a little lump on his neck the size of a pea. And he said he knew exactly what to do because his brother had been diagnosed with the same type of cancer. And sure enough, it was malignant. And Jeff went through a lot of radiation and, had a really rough time, but he is magnificent. And he's actually on our website. And my sister lives in Richmond, and she saw his 1-minute video, his 1-minute advertisement on TV. And I think media has to be part of it, getting the message to the public. And his message is very clear. My name is Dr. Jeff Blackburn. I'm an oral cancer survivor. If you or a loved one has recently been diagnosed with any type of cancer, your first step in medical treatment is your dental clearance. Call our office today. You will be seen same day. And he leaves 2 openings a day, and sometimes Jeff works through lunch, and sometimes he works after quitting time, but he takes care of all cancer patients and their loved ones. And he didn't do it for personal gain, but I can assure you his practice has doubled. He now is referred by the radiologist, the oncologist, the ear, nose, and throat. Because he has a personal relationship about the disease, he's very, very emphatic on helping the cause.
And that's so awesome that he's out there. And what's amazing in this time of social media is that anybody listening to this message could take that 1-minute message on a link and share it with all their patients. I mean, a lot of the work has been done, and your organization does a great job of assembling all of this work that's already been done to make it easier for the average dental office or for any dental office to share this message in all of the ways that are effective today, whether you're on TV or radio, or you're going to use your social media, your Facebook page, your website. I mean, the work's been done, and that's what's so amazing. And I really applaud your organization, IDLE, and I applaud you for being on this mission. And it's such a great coming together because it's really what AAOSH was always looking for. And I'm very, very excited about our partnership. And this particular doctor is passionate about it because he's been through it, he's experienced it, he survived it. So let's take his miracle and share that with the rest of the world, which is love. Don't wait for it to happen in your midst. Use what has already happened as a way to share it with the world. And thank you for that, Linda. Now,
you're so welcome.
One of the things that we're excited about, because you mentioned April, is the Oral Cancer Awareness Month.
Exactly.
And in this brand new partnership with IDLE and AAOSH, we are going to be getting together and doing a webinar where we're going to go over some of these things and some of the work that you've done to share some of the questions and some of the things that could be said in the dental office, and how they can get more involved with IDLE, and we'll even help the people understand how they get more involved with AAOSH. But it's this coming together that I think is going to bring us a lot of good to organizations to get this message out. I'm very, very excited about that. So we have this webinar coming out in April. What and okay, now do you recall the date of our webinar? Actually, the webinar will always be available once it's on. So even if somebody's watching this after the date of the webinar, on the link that you're watching this, if it's on YouTube, that information will be present on there, and plus we'll share that date. But it's April, I believe it's April 15th, I think.
I think it's on tax day.
Yeah, right. So if you see this after April 15th, we'll always have that available for you. And we're very, very excited about doing this webinar together and about addressing the great need in this oral cancer realm that our profession should be doing. And who better than to lead this than Linda Miles? Like I said, who in dentistry doesn't know the name Linda Miles? And we've read your articles, we've seen you live, we've consulted with you, and that now you've taken the time to give back in this way is just phenomenal, and I'm so excited about our partnership. And that's was the point of us getting together today. And did I leave anything out, Linda?
I think that we covered everything, Chris, and I'm very excited and proud to be part of AOSH. And I really can't take credit for, being the only founder, because there were 22 founding members, and we have advisory people like Matt Steinberg, Bonnie Hickson, Robin Morrison, and dozens of others. And I'm just proud to be part of it. And there's another group that's starting too. It's called AADO, and that's the American Academy of Dental Oncology, and that's Dr. Dennis Abbott's group, and I'm on his advisory board. So it's just spreading the word through multiple people and multiple organizations, and that's really what IDLE hopes to be, kind of the umbrella, and we're all just one spoke in that umbrella, and we're all headed in the same direction. So I'm excited about IDLE and AOSH.
It was a wonderful coming together of forces, and we're excited about the webinar we're going to be putting on. And it's the kind of webinar you want to show your team and share with all of your dental colleagues, and anybody that's seeing this video as our announcement of our partnership. Feel free to share this with your dental colleagues as well, or your dental media. Put it on your Facebook site. But we want good things to come through this partnership, and it's all about taking care of the patients that really entrust their lives to us.
To us, absolutely.
And sometimes we forget about it in dentistry that honestly, I went into dentistry because it wasn't a life or death thing. I'm thinking like, oh, that'd be a little too much for me to handle if I went into medicine. Who knows if I could have got into medical school anyway. But anyway, but the longer I'm in dentistry, the more it is about life and death.
It sure is.
And that's so exciting for me to see this transformation of this profession that that used to just be about teeth. Well, teeth are still very important, but now we're saving lives. And
it's the whole health mission.
It is. That's what's that's AOSH's purpose. It's connecting that mouth to the whole health of the body. And so thank you, everyone, for being here. Thank you so much, Linda Miles. We appreciate your time. I'm really excited about where we're going with all of this. Step number 1 is our webinar in April. If you have any interest in this, contact Linda. Why don't you give them your website, and they can contact you at your website, I imagine, again, for any information they might want from you.
Yes, it's oralcancercause.org, O-R-G.
Okay, and of course the AOSH website is AOSH.org. That's AAOSH.org. And information about our upcoming webinars, or if you are listening to this after the webinar has taken place, you'll be able to get the replay. And we're excited about where we can take this. So once again, Linda Miles, thank you so much for your time.
Thank you, Chris.
I look forward to working together, and we're going to save some lives. What do you say?
We are.
All right. Thank you, and we'll see you on the webinar.